Do you really need script for practicing OSCE? Hey guys, welcome back to my channel. This is Reema. I'm one of the RN who got the registration in Australia via OBA Pathway, and today I'm here to share my knowledge on OSCE script. This video is for those overseas RN who is going to give the OSCE examination in Australia via OBA Pathway. So hopefully this video will be helpful. Disclaimer, this video is solely based on my knowledge, so please also do your own research and make your own script to help yourself. So now let's not delay and move forward with the video. So what is the script and why I am talking too much about the script? So basically, script is a guide that helps a person to give their examination in a flow. There are lots of advantages of making a script, which can be listed as: number 1, saving your time; number 2, to run your exam smoothly; number 3, to build your confidence; number 4, to prevent any kind of hesitation that may happen in between the procedure while you are talking; number 5, to prevent from forgetting any steps during your procedure. The list goes on for the advantages. So the main aim for the script is to save your time and to run your procedure smoothly throughout the provided time. Another common question that people ask is, should the script be same for each individual? No, it is not necessary to have the same script for each individual. It may depend on your own research, the resources that you have used. So each script will be different from each individuals. So now let's talk about how to build a good script. So to build a good script, you need to know what are the things that are going to be assessed in your examination, right? So when you go into the AFRA manual handbook, there is a section which mentions the things that you are going to be assessed during your examination. So one of the reasons that we are using the script is to make our communication flow smoothly. As you can also see in here, the communication is the main thing that is going to be assessed during your examination. So here it clearly mentions in the AFRA manual handbook that the examiner is going to observe how clearly the care, diagnosis and treatment are explained. Similarly, how we take the consent for any kind of procedures, and how we demonstrate the compassion of care during our communication or during the whole procedure. Therefore, when you make your script, it should be clear, simple, and understandable. So how you can make a script? So to make a script, you need to first understand the things that you are going to do on a certain station. For example, there are 10 stations that are given in the OSCE examination. So you have to go through all those stations and you need to learn what are the important things that you should not miss while you're doing that procedure. Then you need to learn, you need to do your own research, what are the things that are important in that specific procedure. Then only you can make your script. For example, let's say I need to do the vital sign skill set. So first I need to understand what are the things that are done inside the vital sign assessment. Like we need to do the blood pressure, we need to do the temperature check, we need to do the heart rate check, respiratory check and everything. So we need to make sure we know what are those things, what are the values, what are the normal values that falls on these things. Like for example, heart rate 60 to 100 is normal. You need to understand those things, and then you need to understand, like, you know, what sort of things will affect the vital signs. Like for example, pain, any chronic health disease condition would affect the vital sign. So you need to make sure you understand what is vital signs, what are the things that will come inside the vital signs, and what are the readings that are normal in that vital signs. And you need to understand all those things before you make the script, so it would be easy for yourself to make a script as well. Okay. Alright, so to make it more clear, let's build a script so you would be able to understand. Alright, so the first thing, when you start your procedure, it should always be danger check. No matter it is emergency or it is non-emergency, always check the danger for patient, for yourself, and the environment safety. So when you check the danger, it will also include the infection. So when, let's say, suppose your patient have a tuberculosis or any kind of respiratory problem such as COVID, then it will be given in your question that the person have a COVID infection. You need to now make sure, okay, I need to use the droplet precautions, or I need to use airborne precaution, something like that. So in the question, it will mention if there's any kind of infection, and the environment check or a danger check you will have to do by going into the scene and observing the area. So let's say the first step is danger check. So when I do the danger check, I'm gonna say, upon entering my patient room, I can see there is no any danger. My patient is on standard precautions, or my patient is on airborne precaution, or my patient is on contact precaution. So that's how you do the danger check. It will include the environment, it will include the patient surrounding, and it will include for your safety. So you don't have to exaggerate like there is no any hazards, there is no any fire hazard, there is no electrical hazard, there is no any physical hazard, there is no any chemical hazard. You do not have to go like, you know, particularly each hazards or something like that. It can be like general, such as upon entering my patient room, I can see there is no any danger. My patient is in standard precaution, so I'm gonna go in my patient room. That's all. That's not difficult, isn't it? Okay, so once you do the danger check, the second would be privacy. So when you go enter, let's say you will say, okay, now I'm gonna close this door behind me to give the privacy to my patient. Okay, so giving privacy can come second or it can come third as well. It doesn't matter, but do not forget to give privacy. Okay, so once you give the privacy to your patient, now you will walk in, you will do the hand wash. So you will, while you're doing your hand wash, you don't have to do the like, you know, soap water hand wash, something like that. You can do the general alcohol based hand wash. So when you are doing the hand wash, you will go enter the room and you will say, you will talk with the patient, you will give your introduction. So in your introduction, you can say, let's suppose your patient name is Molly. So you will say, hi Molly, this is Rima. I'm one of the registered nurse looking after you today. How are you today? That's all. In introduction, you do not have to go very vague. You do not have to explain everything. You just say your name, you just say your role. That's it. And then you ask the patient how they are. It's not even compulsory for you to ask. Just introduce yourself. So with the hand hygiene, just remember the 5 moments of the hand hygiene and do it particularly, okay? So you do not have to say every time I'm doing hand washing and all. You just show it like you are doing it, okay? So that's like, just include the 5 moments of the hand hygiene. And for me, I usually like to do the danger check, provide privacy, do hand hygiene, and provide my introduction to the patient. Alright, so now after completing my introduction, I would like to explain the procedure to my patient, and I would like to take the consent after I explain the procedure. So it can be done vice versa as well. You can also ask the consent and then explain the procedure. So there is no any rule that like, you know, you need to first take a consent and only explain the procedure. So that's what all the script is about. So each individual will have their each preference, so you can do it how you like. However, there are only few things that you need to make sure it is done first, and then the another thing is done last, such as danger check. Okay, so now how can I explain the procedure? So explaining the procedure doesn't have to be vague and long. So you just need to make sure you just give enough information, such as, let's say, because I picked the vital signs, I'm just gonna say, today I'm here to do your vital signs. So I will do your blood pressure, heart rate check, respiration check, and your temperature check. Is it okay with you? See, it doesn't take even 30 seconds. So you just say what you are going to do, and then you just take the consent. It's more easy. And then once the patient says yes, it's okay, you can proceed, then you will do the ID band check. So with the ID band check, involve the patient, just tell them, to confirm your identity against my chart, I would like to ask your full name, please. Or can you please tell me your full name and date of birth so that I can match against my chart. So anyhow, it's your role. Anyhow, you just have to make sure you have got the right patient. So you just check the name, date of birth, URL number, And that's it. And ask if they have any kind of allergies. Okay, so that's how you the ID check and allergy check. So once you do the ID check and the allergy check, so from now on here, depending on the skill set what you are doing will define what is the next step. Since I'm doing the vital signs here, I would like to ask the person a few questions before I go and collect my equipment. So just tell them, okay, I have done your ID band check and I know you are my patient. So I would like to ask you a few questions before I go and collect my equipment. Is that okay with you? Something like that. Or like just say, I need to ask you a few questions before I do your blood pressure. Is that okay? Yeah, that's all. And then remember the questions that you made during your while you did research for your skill set. Ask those questions. For example, in vital signs skill set, I will ask my patient, are you a smoker? Have you done any smoking in last 10 to 20 minutes? Have you done any strenuous exercise in last 10 to 20 minutes? Do you have any chronic health conditions such as hypertension or any heart conditions or any respiratory problems? Are you in pain? Anything that affects my vital signs. And once you get your answer, okay, tell them, all right, Molly, I'm just gonna go and collect my equipment. Please wait for me. And that's all. And you go and collect your equipment, and then you come back, you do your hand hygiene before touching your patient, and then you say, okay, I would like to start with your blood pressure. Is that okay? So just make sure your patient is comfortable, you put them in the correct posture, positions. So all these things depends on your knowledge, on the skill set. That's why it is very important for you to have a knowledge on the skill set before you make your script, so that you can include all those things in your script. Okay, and now once you perform your skill set, there is a thing you need to do documentation. So with documentation, providing health education, you can do like, when you are performing a skill set as well. So for me, I usually like to give health education when I am actually performing the skill set. So let's say I did the blood pressure and the blood pressure is like now 120/88. So I will let the person or the Molly know that, oh Molly, your blood pressure looks good, it's perfect. Or if it's low, like 101/66, oh Molly, your blood pressure looks slightly low. Do you have any symptoms such as dizziness, lightheadedness, or anything? And then once the person says, no, I'm fine, then give them some water to drink, ask them when was the last time they had the fluids and food, and offer them fluid and foods if they can eat. Yeah, that's all. And that's how you do the health education. And if any other abnormalities, tell them I will report it to the doctor and I will let you know what we will do. Something like that. So there is no such rule that like health education should be given at the last and documentation should be done at the end. So that's why I say each individual have their own preference and they have their own script, and just do how you feel comfortable. Just make sure there are a few things that needs to be done in orders. Just follow them. That's all. So with me, like when I give the health education, after finishing my education, I will let the patient know, okay, I'm gonna now report and I'm gonna now document it in your chart, so please give me a time. And then you just document it, and that's all. And then now you finish. And if you get the time, you can go back and talk with the patient. Or if you do not have time, then of course you will be off. But if you get time, just go back to the patient, ask them if they have any questions, is there anything that they want to know. And then if they say no, then give them the call buzzer and say, okay, here's your call buzzer. If you need anything from me or any help, just press the buzzer. I'll be right around here and I'll come back to help you. And thanks the patient for their time and give them thank you. Thank you so much, Molly, for your time. I will see you later. And that's all. So it's not like rocket science. So you just have to follow the order, how you make it. It helps you to prevent from forgetting any steps in between. So that's why the script is important, and that's why it is important for yourself to make the script rather than following the other people's script. Okay, now I'm gonna summarize the script that we just talked about. So first, we're gonna do the danger check. Second, we're gonna provide the privacy, do the hand washing, and introduce ourselves. We can take the consent or we can explain the procedure. For me, I will explain the procedure and take the consent, and I will then do the ID band check and allergy check. Then after that, I will ask the procedure related questions, and I will go and collect my equipments. I will do a hand hygiene again. I will perform the task, and I will give the health teaching together with the task, and I will do the documentation after that, and I will thank the patient. So that's how my script look like. I am not suggesting you guys to follow my script. I'm just giving it as a reference how I use it. So you can also make the script like how I did, or you can do your own research. You can follow the videos around, and then you can make your own script just for the reference. Okay, guys? So that is the script. So when you deliver the dialogues of the script that you practiced, just ensure you do not like read out like you memorize it. Just go with the flow and the communication, and just ensure you do your hand washing in between, like using the 5 moments before touching your patient, after touching your patient, and before, like, after touching the surroundings and all. So you know that. And just make sure you have the infection control policy on your mind, and also make sure you do the eye contact with your patient. You build the trust, you show the empathy towards your patient. You just show that like you are listening to your patient. If they are asking you something, give them a good explanation. Like, if you do not know anything, don't worry, just let them know, oh, I'm sorry, I did not knew about this, but however, I will go and do my research and come back to you and let you know. You are a human being. Of course, you need to know, like, what skill set you are going to perform, what are the things that is necessary in those skill. And then sometimes I know it may be out of your hand, that like you may not remember everything, especially during the medication. I know medication is very difficult, and then you may not know all the medications, of course, like, but it's okay. You are a human being. Just make sure you utilize the resources that has been provided by the exam center. So like, you give your 100%. So don't be too nervous, don't be too anxious, go with the flow, follow your script. And if there's anything that you do not know, just don't like, let that get over you. Just tell them, okay, I'm sorry, I did not know about this, let me have a quick look on my book, or like, let me have a quick look on this medication book so that I can explain it to you. Have a presence of mind in your examination, which is very important. That's what more important. So that's what is OSCE all about as well. Okay. And another thing, like when I talked about the chronological order, let's say if we are doing the basic life support, then in that one, you may not have time to, like, do the patient check and ideology and check when you go into the patient room, because it is emergency, right? So in those cases, there may be a difference, such as like you will do the danger check. Danger check is must for all the stations. So once you go do the danger check, and when you enter the patient, you will find your patient unconscious. Then you do not, like, you're not gonna take like, oh, can I please take your consent? You're not gonna do that, right? Can I give you privacy? No, you're not gonna do that, right? So those are the things. So that's how you make the script. So it depends on your station and depends on your skill set. So in those kind of emergency thing, you will do the danger check. When you go enter the patient, you will find the patient unconscious, and you will just right away do your skill set. So that's what it is important. So that's why we make the script, and that's how it differs from stations to stations. That's why I always recommend people to make the script by themselves, so that they know how comfortable they are with their dialogue delivery, and then they know, like, what they have made, and then how they can deliver it. Because when you do it by yourself, then you will understand, like, things that are important, the things that you need to speak up. Because not every person like speak like I do, or like not every person have their own point of view, or like communication way. So it depends on each person's personality, and then how they communicate. So it is important to make your script by yourself. And however, you can of course, like, take a reference of my script, or like take a reference of your friend's script, or from any videos that you see. However, it is important for you to remake for yourself and implement it. Okay. Alright guys, that's all about the script, and how you can utilize the script to make your OSCE run smoothly. I hope this video has been helpful. Please don't forget to follow me on Instagram, TikTok, where I make such videos and upload in there as well. Don't forget to like, comment and subscribe. And if any of your friends or family are going to give the OSCE examination in Australia for RN registration, please share this video. I hope this video has been helpful. And if you have any questions, or if you wanna see any videos in future, please don't hesitate to comment, or pass me the message in my Facebook, in my Instagram and TikTok. I will see you in my next video. For now, bye.